Conversations with Nicole. Let's talk about it. Tell me all about it. I'm here. I want to know what's on your mind. Ooh, the world needs to hear from you, and I'm so glad to have a conversation to reach the nation. And it's all about you. We'll help each other to discover innovative ways to positively change the world. Let's talk about, let's talk about, yeah. Let's talk about conversations with Nicole.
Greetings. Welcome to Conversations with Nicole. I am Nicole Everett, your host, and Conversations with Nicole is a talk show based here in Tallahassee, Florida, focused on connecting the community through conversations. And today is what I call Mindset Monday, which is an opportunity for you, me, and my guests to chat about an interesting and intriguing topic. And today we are talking maternal mental health. May is Maternal Mental Health Month. Heck, May is Mental Health Awareness Month. And so my very special guest is Miss Lola Brognano, who I met at an event in the community. I guess it's been I don't know if it's been quite a year, but at any rate, I was blown away by her at the event and said, we got to talk. And so we did, and we decided to have this conversation during Maternal Mental Health Month because she is a perinatal clinician specialist. And so I'm super excited and delighted to have her here with me tonight. But before I bring her on, I need to hear from you. Where are you tuning in from? We are live on Facebook, on YouTube, and on LinkedIn. And this is a safe space for us to communicate with one another. So if you will, put your city and state in the comments and tag a friend, tag everybody, like and share, tell them they need to be on here because this is going to be a great conversation. Again, your comments, your questions are very much so welcome. And it's a safe space for us to communicate. So I see them chiming in, Miss Lola. You look, you brought the troops out tonight. Listen, they are ready for you. All right, my mom is here from Miami. Thank you for being here, Ma. I love you. Stacy Rawlerson, thanks for having me. Thank you for being here. Shanna R. from Baltimore, love it. Thank you for being here. Tara Griffin in Jacksonville, Duval, thank you for being here. Dr. Melanie Barton in Tallahassee, thank you for being here. Little Breezer in Tallahassee, thank you for being here. Miss Jeanette down in Miami, thank you for joining us, Miss Jeanette. Rachel McAllister in Tallahassee, love it. Thank you for being here. Kauai Cats in Fairfield, Iowa. Love it. I've been following Lola forever. Thank you for being here. Appreciate it. Charlotte Curtis in Tallahassee, thank you for joining us. Tara Griffin said Lola is the best of the best. Yes. All right. We got a LinkedIn user. Who is this? Oh, Cindy. Cindy was on my show last week talking about ACEs. ACEs matter. Love it. Thank you for being here, tuning in from Orlando. And yes, Rachel is ready for Lola. So I'm not going to hold y'all any longer. I'm going to share some of her bio. Lola is an extensively trained licensed clinical social worker in private practice in Tallahassee, passionately believes in maternal mental health care. It's a necessity, not a privilege. She is a certified perinatal mood and anxiety disorder specialist, a birth trauma level 2 specialist, is EMDR trained, and is a certified pregnancy and infant loss advocate. She has specialized training in reproductive and fertility psychology, and her work is centered around maternal perinatal mental health, issues such as postpartum depression, perinatal and infant loss, grief, labor and delivery, NICU, or reproductive birth trauma that is inclusive of high-risk pregnancies, and the fertility spectrum that includes carrier consultations, IVF, multiple loss, adoption, and infertility. She has extensive training. I'm not even going to go into some of these trainings that are mentioned, but She does offer local classes to communities, stakeholders, and specialized consultations for providers and for clinical interns through her LLC. She also is the facilitator of Capital Area Healthy Starts free monthly virtual perinatal grief and loss support group. And we will get into how you can contact her later, but you all can please help me welcome Miss Lola Brognano. Yay.
Hi.
Hey, welcome, welcome.
Thank you, Nicole. I don't know if I can live up to that amazing
Oh,
run-in you just gave
yes,
me.
you absolutely can and do. Listen, I could tell by all of the views that we have on here right now. So I appreciate you so much for being on here. And that was Catherine. I can't remember Catherine's last name. It's escaping me right now, but it was Catherine's podcast, live podcast that she did at
Catherine Young.
yes, Catherine Young at
Hmm.
the down at the Cascades,
Yes.
Parkview and Cascades. And so our paths crossed there. And so I'm so glad that we are able to do this right now. So before we get into our conversation, my question is, who is Lola Brognano? Not what you do, but who are you in your own words?
Oh my goodness. Uh, I now I feel like I'm switched and I have no idea. Um, yeah, I'm about the same person I am in my personal life, but I am in my professional life. I have a lot of passions, and I am very much involved in community, and I have a nice tribe around me. I like to do self cares that I believe self cares is self preservation. I don't think it's selfish. I think it's self preservation, and being a servant leader is very much what I kind of put my life around, and so it matches both personal and professional.
Love it. Love it. Love it. And so that totally aligns. I didn't mention this to you, but I have on my self heavy on the self-love shirt today. Okay.
Yes,
Because we
yes,
all
ma'am.
need to be heavy on the self-love, especially with the state of our nation right now. So
Oof,
woo,
that
anyway, but
right.
that's a whole nother topic. All right.
Yeah.
So we have a number of folks chiming in. So I definitely want to attempt to acknowledge as many of you as I can. So Beth in Crawfordville, thank you for joining us. Okay, again, Cindy, this is she said I was on the call where Doris was also on the same call. Wonderful. Melissa in Tallahassee, thank you. Dr. Sherry Sutton Johnson in Chattahoochee, thank you for being here. I appreciate you. She's been on a few times.
No, thank you.
Kelsey Pays in Tallahassee,
Hey,
thank you so
Kelsey.
much. Miss Gail Dixon, go Lola, watching from Tallahassee. EMDR has been proven to be
Yes,
helpful. Yes, absolutely.
absolutely.
Absolutely. Camille Rankin from Tempe, Arizona is watching with the group. Wonderful. Thank you so much. Excited to hear from Lola. All right. So, and Alicia Jackson, Dr. Jackson, who is a counselor at the FAMU Counseling Center. Thank you for joining
Yes,
us.
thank you.
Lynette Mariah in Tallahassee. Thank you for being here. So we're gonna get started, but again, this is interactive. So I invite you all to have comments and questions. But I do want to read my disclaimer before we get started, since I have a licensed clinician on, and that is that all topics past, present, and future on Conversations with Nicole are for informational purposes only. They are not to be used as a diagnosis for treatment or an answer to any personal issues related to the topic being discussed before, during, or after the program. So, woo, maternal mental health. So, I feel like I'm still kind of new to the mental health space. I mean, I am a mental health advocate. I probably got started on this journey in 2017, but maternal mental health is something that's
Mhm.
still really kind of new to me. Okay. Um, I probably have been introduced to it with Capital Area Healthy Start.
Mhm.
as well as through so my mental health counsel colleague, Dr. Heather Flint, she deals with maternal mental health. They have
Mhm.
a conference each year here in Florida that deals with that topic, but there's so much to unpack there. So I'm gonna kind of let guide us a little bit with this conversation, because I feel like a little bit of a novice here.
Well, thank you very much for kind of bringing up that it's kind of new to you. I think that it's kind of new to a lot of people because
Mm,
it was never really given space before.
yeah.
And maternal mental health, um, people have an idea and then kind of don't have an idea of what that is. And so I'd also kind of like to start off a little bit about that. The language that we're going to use tonight, I think, is very important to kind of address that.
Mm,
um, Typically, historically, language such as mom, mother, woman, breastfeeding was often used to describe pregnancy and postpartum experiences. And then as we started to become more inclusive, our language altered. However, the state of it being right now, we're going to keep it interchangeable, although it's likely going to fall on the historical use of language that most of us are used to.
okay.
With that being said, one of the reasons being, and it should be noted that most of what we talk about today, especially statistics and research, is again was historically mostly conducted on cisgendered heterosexual white females. Okay. And so we have to take that in context
Yeah.
as well. I'd also like to say, because we're talking about maternal mental health, and we'll say what that is, also, y'all know yourselves, please take care of yourselves. If something is heavy, if something is a bit much for you, do
Yes.
what you need to do to take care of yourself while you're in this space. This is a safe space, but
Yeah.
it is also your space as well. And with that being said, maternal mental health is kind of like, it's an umbrella term.
Mm-hmm.
It's that emotional well-being of women during pregnancy and postpartum.
Okay.
Okay. And it's like, it's an umbrella term for all of the things that kind of come with that. So, perinatal mood and anxiety disorders. We learned a lot that it's not just postpartum depression. We can have it during pregnancy as well,
Right.
which is why we use that term perinatal now, the time before, during, and after pregnancy.
Mm-hmm.
And it includes things also such as pregnancy and infant loss, birth or NICU trauma,
Mm-hmm.
obstetric violence. That's also a new word, though it's not new. It has to do with consent and in the birthing room, not being asked for consent for an episiotomy or a membrane sweep. Outside of that room would otherwise be considered assault. However, in that room, it's allowed. It's allowed. And
Mm-hmm.
so we can get a lot of birth trauma coming out of that room, and that can change an entire woman's experience. We have a lot of fertility things,
Mm-hmm.
trying to conceive, multiple losses, the grief that comes every month if a woman's trying to conceive and she gets her period, complicated grief, and things like that. So it's a pretty, big umbrella for a thing. And I think that's why we get a whole month, thank
Yeah.
goodness. We need it. Although, to get back to what you were saying, right, how new it is, I also find that to be fascinating in a sad way. And
Mhm.
it makes me passionate for this to change, is
Yeah.
that we are at least 50% of the population.
Mhm.
And why this is not talked about, known, how oftentimes, even between women and mothers, it is not shared. Generationally, we have issues when it comes to that as well. Right. And so that can be another obstacle to this
Mhm.
whole thing.
Yeah. Absolutely can be an obstacle. I think so. I'm gonna share a brief story. I was at I previously worked with the local health department, and was in the community department, right? So we did a lot of outreach. And one of my colleagues, because I was my job specifically was providing mental health and substance abuse or substance resources um, to the community,
Mhm.
especially Frenchtown Southside. So
Yeah.
one of my colleagues had a mom who was 9 months pregnant who was having suicidal ideations.
Yeah.
And so
Mm.
thank God, I'm gonna have to say this. Thank God, there was a perinatal professional who had posted a flyer in the ladies' room at the health department, just basically saying, I will give services to any pregnant mom or mom who was recently pregnant. These services are free. So I ripped the tab off of there and gave it to her because this is so specialized, right?
Yeah.
And so, I'm literally like trying to talk this mom down from dying by suicide.
Right.
I mean,
Right.
she had other children,
Mm.
small children, and she was just at her wit's end
Oh,
about it.
yeah.
And so
Yes.
this particular provider, she, helped her and was great. And I did a lot of follow up, just checking in to make sure the mom was okay. And I got to see the mom a year later, and she just was radiant.
Yeah.
And
Yes.
I think about that day when I saw her, she was just so frantic. And so, but I had not experienced that,
Yeah.
like the whole maternal mental health piece. I
Yeah.
had not experienced that before. And so that probably, like, I had heard about it, but I really kind of dived into it more having had that experience.
Yeah. And that's a big experience.
Mhm.
Okay. That is a big experience to walk in on, and the numbers, are 1 in 5. One
Yeah.
in five women, 1 in 5 women,
Whew.
1 in 5 people who are giving birth, okay, who have the ability to give birth, just there have risk factors. And then we start adding things on, right? Such as, have you yourself ever had any kind of anxiety or depression before? Have you specifically had postpartum depression and
Mm.
what that can be like? Family history, have our sisters, our mothers, social determinants can
Yeah.
be big factors. Past trauma, NICU trauma,
Mm.
complicated grief, minors.
Yeah.
Um, if we're in poverty, if we are unmarried and or unpartnered,
Mhm.
um, military families, marginalized groups,
Yes.
you can start to see, right, that it starts to become smaller and smaller and smaller.
Mhm.
And when someone has no knowledge, right, they've never had it themselves, they've never been around it.
Yeah.
When something like this comes along, okay, oftentimes, it's big drastic situations that are going on. And,
Mhm.
it's a whole spectrum, right? Of course, just like
Right.
everything is. We can, matter sense being, right, that physical, emotional, hormonal, and social transformation that a woman, a birthing person goes through after becoming a mom, a parent. It's called
Mm.
matrisense. It's literally that time period,
Mm.
and it's like a rebirth.
Mhm.
It's like a rebirth, and during that time, okay, the first 2 to 3 weeks are typically the baby blues, and it's important that we know what that is. It's very common. It's expected. The
Yeah.
baby blues, up to 86% of women have reported that, and how we know what that is. And oftentimes we think that's what it is when it might not be, and we want to know the difference. And
Mm.
that's why we're here today, to try to spread awareness so that women and people having birth can understand what they're going through. Because oftentimes um, people don't know something's wrong. They just think something's wrong with them.
Yeah.
Okay.
Yeah.
Right. And we don't want to say normalize. We're trying to move away from that. We don't want this to become normal to where someone thinks they don't need help. We want to commonize it. We want to
Mm.
commonize this experience and unify it. But we don't want to use the word normal anymore. We want to kind of move away from that because we don't want anyone thinking, oh, this is completely normal that I feel that I would be better off this planet. When that's not, no, that's not normal.
Yeah.
And we need to take care of you. Right. And so thank goodness that we do have those providers, although there is a massive shortage of specialists. If we're going to talk about reproductive and perinatal psychiatric specialists, there's only 500 in the country. And if 1 in 5 women, that's 800,000 a year. Right. That is a huge, that's like 1,600 per one. How? That's not possible. It's not even good medicine. Yeah. Right. And so we need to be able to move away, right, from the deserts. We know we talk about food deserts and all those kinds of things. We need to talk about maternal mental health deserts as well. And Leon County and the outer counties, absolutely. We want to go out to Gadsden County and a few of them out there, Wetumpka area. That's a desert, you know, right?
So Little Breeze said, I was so confused when I was experiencing so much anxiety and rage postpartum. I had dealt with depression and anxiety in the past, but I didn't recognize it because it felt different.
Absolutely. Yeah. Oh, yes. Oh, this is something that a lot of times can be a tragedy when someone is actually trying to go for help. And a clinician has worked with anxiety and depression before, so they assume that they can work with perinatal anxiety and perinatal depression when it presents completely differently, and oftentimes it will get missed, or invalidated, unheard, right? And it doesn't show up the same at all. It can be very confusing. Mom rage is a real thing. It's a real thing. It's real. It's true. It's really hard. It is not a representation of our mothering, of our parenting. It is a representation of overwhelm, of unmet needs, and a need for additional support. That's what that is, mom rage in reality. And that is systemic patriarchal coming down from the construct of the default parent being the mom, right? You know, it's that meme. That meme that I love and hate at the same time. It's a perfect representation of the maternal mental health crisis that we actually have, which is, it shows this dad coming in, and it's, you know, and the kids are there, and he's got a bag of, you know, chicken McNuggets, and it says on his shirt, it says "Fun Dad," and then the next meme, it has the mom, the kids are there, and she's got a bag of McNuggets, and it says "Lazy Mom," and literal same thing. It's the literal same thing, but somehow we have different expectations, right, of moms. We become a part of that as well, because we have been indoctrined. We have been in the construct as well to believe the same narrative, which is a false narrative, in my opinion, completely false. We hand women these, you know, narratives and constructs that are completely false, and in my opinion just sets women up, right, to feel like failures as parents, always feeling guilty and always feeling shame about every decision they make in parenthood.
No, that's very real. Kauai said, that's crazy math. So I think the numbers that you were giving. And Tara, we need more providers, especially OBGYN providers, who will talk about it and embrace it, not just administer a questionnaire and keep it moving. Ooh, listen, you have hit the nail on the head with that one. Get comfortable with the uncomfortable. But I think also, and I'm glad you brought this up, Tara, or Tara, that, you know, while yes, they have this questionnaire, it's a checklist. What if all of your, you know, your responses are to the extreme of not being okay, right? Then what? I'm always really curious about that. Like, are they going to refer you to a clinician because they're not really capable of tackling those questions or tackling what might be wrong with you from a mental standpoint?
That is so complicated. And I can tell you, just from the Leon County standpoint, because I'm a part of that task force of going around the local OBs and going around and actually finding out how they run their procedures and where are the loopholes and the gaps. And a large portion of it is the assessment part. It's not just, it really isn't, it isn't just the follow-up. It's also, how are you asking the questions?
That part.
Right. Okay. And when you're not trained, I can understand how you might not understand how to ask certain things, even though I think, like, how could somebody not ask it in such an empathetic way? But if someone comes in the room after you've filled out all these papers and you finally telling the truth, maybe for the first time, right? Taking that risk of, they're going to think I'm crazy or they're going to take my kids away. Right. So you finally answer the question truthfully, and either nothing happens, gets pushed along, or the nurse usually comes in nervously and is like, you're not actually hurting yourself, right?
That part. Yes.
So I'm going to say no now that you just said it that way.
Yeah, exactly.
Okay, so it's all from the jump. It's from the jump. It's from how we ask the question to the follow-up. And the research that we found here in Leon County is doctors are extremely uncomfortable talking about this. They're not adequately trained at all in mental health. They want to push it off. And so what's happening is 75% of women are being untreated. And we know that comes with drastic consequences, as we know, systemically, right? Nicole, I know you know that as a community leader, that it moves to baby, to family, to community, to right. And so negative outcomes, increased chances of suicide, infanticide, of ACEs, of poverty, of all of those things, right? All of that. And so it costs also, the insurance companies that run everything, really, if they're all about the bottom line being the dollar, it fascinates me that they would rather not pay for mental health. They make it so hard to be accessible, but yet it costs over $14 billion a year for untreated maternal mental health. Yeah. Okay. And that has drastic consequences, as we know, into communities that can't afford those kinds of recoveries, right? It takes away funding for things and less providers. And it's just a whole cycle of lack of access, which means lack of treatment, which means lack of recovery. So the woman that you met is just such a tragic, perfect example of how you can be so desperate, but have recovery at the other end. And that's what we know to be true about maternal mental health, is that it is not your fault. You are not to blame. And with help, you will be well.
Right. So, Stacy, the pediatricians need to be trained. OBC, the postpartum part one. One time, and that's it. Yep.
Yeah, she's right. She's right. I mean, we'll have 17.23 million visits before, and then that 6 weeks later really is just say if we can knock boots at that point. They're not even asking. And she's right. The pediatricians are the one who sees mom again as the default parent most after that. And they're not asking those questions, although now more than ever, we're starting to have programs where that's included, including up at TMH residency program. They have started to train their residents in maternal mental health, including their pediatricians.
That's good. Okay, Kelsey, parent, OBGYN, and mental health services in the same practice is a great step in the right direction. I like that idea. Yeah. And Miss KJ, we need more providers who specialize in perinatal mental health. We absolutely do. Absolutely do. So we are about halfway through our conversation. The time is flying right on by. So for those of you who are just tuning in, I am on with Lola Brognano, who is a perinatal counselor, therapist, clinician, guru here in Tallahassee. We're talking maternal mental health. May is Maternal Mental Health Month. We did have a question earlier. Kaylin Thigpen, given that women do feel so bad about decisions and may not have the information for it to be an informed decision, is it safe to take medication before, during, or after pregnancy?
That's a great question, because clearly that is something that is likely going to be part of some experience. Some women might come in, right, already taking medications. And so that absolutely needs to be a part of the conversation. And historically, unfortunately, they'll get ripped right off those medications because doctors just do not want to risk. And they either don't know, because back in the day, right, we just assumed that nothing was safe. When we know now that there are actually, more than we think, more safe medications. And what we're finding on the longitudinal studies is that it is more harmful for the mother to be untreated for the mental health issues than possible exposure to safe medications, not unsafe medications, but exposure to safe medications. So one of the reasons why we need more is because the typical OBGYN, the typical PCP, and the typical psych is not going to either have the information or have the updated information or the understanding or the willingness. And so we need more so that we can have an informed and consensual.
Yeah.
What if she's on medication that works and is safe and doesn't want to come off it because she already knows what's going to happen?
Mm-hmm.
Right? If she already has existing bipolar and this medication is safe and works, why would we take her off it instead of monitoring? Right? That's a doctor's job.
And I would say, to the extent that you can pull together a team where all of these folks are talking together about what needs to happen with you, that would be the ideal situation.
Yes,
right?
It would. A wraparound, right? A wraparound team where we have a psych, we have a counselor,
Yeah.
we have a PCP,
Yeah.
depending, we might even have, right, maternal fetal medicine. If it's post, we could have a pelvic floor therapist involved.
Yes.
Why there should always be collaboration. There's even insurance codes for them, though they deny that code. Why would that be, right?
So you really got to advocate for yourself, right?
You have to advocate, and unfortunately, not everyone can.
Mm-hmm. Mm-hmm.
There's a million stories of advocates in the birthing room not being able to advocate for themselves, because of a lot of reasons. What if they're right? What if they're being triggered by previous trauma? What if they're being yelled at like cattle?
Yeah.
Right? Ooh. There's so much that goes involved in.
There is. There absolutely is.
Mm-hmm.
So Mr. Marcus Boston is on with us. He's in Tampa, Florida. He said, I'm learning a lot here today. I didn't know mothers went through so much. Yes, Marcus. Thank you for chiming in. We appreciate that. So Kauai said, how do you suggest being so honest when by doing so people are afraid?
Well, that's a tough one, right? Okay. There's a mistrust in the system. If we come from a marginalized community, if we come from the Black birthing community, there's a mistrust in the system. Mm-hmm. And so it's a hard place to be. It's hard to tell someone, right? You got to trust your medical team when you can't, you know? So what I would suggest is getting people around you, a doula, a community doula. If you have a partner, your partner. Here in Leon County, we have the sister program, the Sister Friends program. Mm-hmm. Finding local resources of things that you can create your own wraparound team so that you're more likely to feel comfortable being honest about how you feel. And other people can also, by the way, pick up on those kinds of things. They're noticing, they know you. They're going to notice your slights. They're going to notice those kinds of things if you're not okay. And my personal thing is if you go somewhere and you don't feel heard, you don't feel validated, you fire their ass and you find the next one, okay? Because we don't have time for that. We don't have time to possibly risk our own mental health, which will translate to our baby's attachment, to everything thereafter. I'd also like to add, just real quick, by the way, I don't remember what he said his name was, Jonathan. He said he didn't realize that mothers go through so much.
Yes,
I'd like to add that 1 in 10, 1 in 5 women or mothers or birthing people have a perinatal mood or anxiety disorder, but 1 in 10 fathers and or non-birthing partners do as well. Okay. And so although they are often forgotten and don't have as many resources, as many safe spaces or support groups, they too absolutely get affected by this big experience, the postpartum period. And of course, they're constructed differently on how they handle it, very differently how they handle their depression and anxiety. So, but I just wanted to put out there that if the non-birthing person is also going through something, that they too can go and get help as well, because you have trained professionals for that.
Absolutely. KJ said, create your village, your trusted circle. And as a follow-up, Kauai said, are there specific questions you suggest we ask?
You could ask, have you been trained in pregnancy or postpartum mood disorders? That could be the first tip. If the person has said, well, not specifically, but I've worked with depression and anxiety before. Okay. That could be the first way to find out if they have training in this. You could also, in my opinion, kind of ask how they feel about the uncomfortable things, such as scary, intrusive thoughts. Some clinicians are a little trigger happy when it comes to things like that, but they have to say that. They have to say, this is what I would do in this situation if you were to tell me something like this. But if you're trained in maternal mental health, we should know the difference between those things. And it is my job to make that person feel like they can tell me the absolute truth of what's going on, because I would know the difference between them, as hard and scary as that is. And there is a difference.
So, Lil Breeza, what is the difference between intrusive thoughts and perinatal psychosis? Just the quick and dirty.
Okay. That is a really good question, because more and more we're seeing postpartum psychosis come into, we're seeing it on TV. We're hearing about it, right? Andrea Yates way back, right? That is a terrible, that's a terrible situation. That goes under perinatal mood and anxiety disorders. It's not just postpartum depression or anxiety. It's postpartum OCD, which is where intrusive thoughts fall under. It's an anxiety disorder. But there's also postpartum bipolar, postpartum trauma syndrome, and then perinatal psychosis. Perinatal psychosis used to be coined as it's rare. And I think they tried to come from a place of trying not to make people freak out. That there's possibly something that could go that horribly wrong. It's not actually as rare as we want people to think. It's 1 to 2 out of every 1,000 births. That's not that rare. What we want to know is the education. Is what we want to know is that it's always a medical emergency. And so the difference between intrusive thoughts and just the quick 101 pocket guide is when someone is saying, that they had thoughts, that they were standing at the top of the stairs and they just saw themselves, just a vision of it, of either baby just at the bottom of the stairs or even themselves throwing, the baby to the bottom of the stairs. Now that sounds insane, right? Like who would, but very, very large, extensively high numbers into the high 70s of 78 or something % of women have intrusive thoughts, and they are still good mothers. They have weird, scary, intrusive thoughts. And so the difference between them, is one of them is intrusive thoughts OC that we kind of explore and we process a little and find out, this one is not the one we're concerned about. We're going to work on it. That's a terrible thought. We're going to get through it. It's uncomfortable. We're going to work on it. But that is not the one that's the medical emergency where we have concern and worry about safety or danger. And that's perinatal psychosis. That's a medical emergency. It's 911. We don't pass go. We go straight to the ER. We call 911. So the way we know the difference is if she tells me, I saw myself, throw my baby down the stairs, and I ask, how did that make you feel? What were you doing? And when a woman says, oh my God, I can't believe that, they become so distressed. They are so upset. It's not in a line how they actually feel. They have no urge actually to do it. In fact, typically what we see are what we call, right, that behavior, the adverse behavior, to make sure it doesn't happen. So for example, somebody might say, well, I'm never going down the stairs with the baby. I'm just my husband. I'm going to hand off the baby every time to my husband. I just won't even, right? They will start sleeping downstairs so they don't have to go up and down the stairs anymore, and possibly put themselves in that position. So we see that the person is upset. They don't like this idea. They don't like the thought of it at all. They try to make sure it doesn't happen. We see a lot of them talk about it when it comes to knives. They'll be chopping up a carrot, and the next thing they see are these awful, horrific, violent things in their mind, stabbing their own baby. And you think, oh my God, how could I? And guess what they do? They hide all the knives. They refuse to have any part with meal prep. That is intrusive OC.
Okay.
When it's psychosis is when she's not bothered by it. She's comfortable. In fact, finds desire in it, feels it's right. It makes sense to her. And it's what we know to be not in alignment with how she would actually feel. Okay. That's when we know. And mostly, right, if we have the village like we're supposed to, there should be signs that people are picking up on. Suspicion, right? Erratic behavior. Okay. Suspicion is a big one. Delusions. Okay. Suddenly, out of nowhere, if let's say you have been an atheist for the last 30 years of your life, and suddenly you say, out of nowhere, you're just sitting there, and your partner looks over at you, and you have this face, stoic, and you say, this baby is the Antichrist. God told me. Okay. That is not at all in alignment with who this person is, what they actually believe. That would be a clue something is wrong right there. And that is the typical 101 guide.
So, Kaylin, I hope that answered your questions about key differences between psychosis and perinatal psychosis, and a little bit on risk factors, because we have quite a few more questions here. All right. So, Melissa, Lola, if someone thinks they have postpartum depression, what should one do? What if the health provider doesn't listen to the concerns?
I would exactly go back to what I said before is like, there are things that we can do, right? Most of us have access. Again, this is, we're talking privilege here. Most of us have access to the internet. We can Google, are there local support groups? We can find out, we can try to find a counselor. And again, asking the questions, do you have experience with this? And checking in with yourself and saying, do I feel like they listened to me at all? And if they didn't, continue until you find someone. We live in 2025 right now. Today, state of Florida still allows virtual. That means I can see someone in Miami who might be a specialist. You know what I mean? So if your insurance doesn't cover, let's say the only specialist in town, demand that they cover it, because there is no other specialist that they can hook you up with in their network. That's their responsibility. That is their responsibility to you. So again, the advocation, unfortunately, it falls on us mostly, as we know the majority of anything with the medical system.
No, I'm glad you mentioned that. Again, advocacy. So you're going to have to really stand up for yourself, fight for yourself. Have a loved one, your village, to help stand up for you, fight for you in that vein. Tara, any information you can give about NICU stays, lack of ability to at times initially connect physically with your child during that time, and how this may impact anxiety and depression?
That is, talk about, a non spoken about space is NICU. Just NICU on its own is traumatic. You cannot, have access to your baby. You can't go home with your baby. Nothing. No one plans for that. So there's no way that was at all how someone pictured this turning out to be, right? So in any situation, there's going to be sense of grief, of loss, of trauma, of anything that comes with that, clearly. And so it is understandable how it might be difficult for someone to connect, right, to their baby if you can't touch them, maybe, or maybe you're protecting yourself so emotionally that, no, this can't be happening. My baby's going to be okay. My baby's going to be okay. That you just kind of emotionally numb yourself over and cut yourself off, right? Because what if the most horrible thing actually does happen? So what we do is we cut our emotions off and disconnect. A lot of women do that during pregnancies. They will disconnect from their own pregnancy and not have emotional connection during it. If they've had multiple loss, they will not. They will dissociate from their pregnancy. They'll dissociate after if they've had SIDS or SUDS, and anything of that nature. And it makes sense. Again, what we're hoping, though, through this is that over time, NICU nurses, NICU social workers are going to be trained enough. They're not just social workers, but perinatal mental health social workers are going to be able to pick up on a mom who's coming in and not at all interested in her baby. And so it can highly affect. In fact, it probably almost guarantees you're going to have anxiety and depression, especially when baby does come home. Holy crap. Now you're in charge with this. It was just fragile just 1 minute before you said I could take them home. And you want me to remember all of this stuff that you had machines, you had nurses. I'm none of those things. And so the anxiety alone, you can see how if someone didn't have anxiety or OC, how the tracking of every little thing can become a problem very quickly if you've been in NICU, right? And it's nearly guaranteed. I wish it would become, again, part of the conversation is if you're getting discharged, it would be really great if the social worker would talk to you about, hey, guess what might happen? Let's talk about that. And let's talk about what you can do if you start to notice these things. They're so common, okay, that this could happen.
Yeah.
Thank you so much. Let me read this.
Oh, my goodness. All right. I want to talk a little bit about social determinants because I feel like they are a bit under the radar.
Yeah.
But they can definitely exacerbate things, right?
For sure. Social determinants exacerbate things, create things, just are responsible for so many things. And social determinants are often, again, in marginalized groups, they're compounded, they're exaggerated, disproportionate. So the disparities in Black birthing community versus white is astounding. And so we know that Black birthing bodies are 3 to 5 times more likely to die during childbirth. And again, it's because of the construct and social determinants such as systemic racism, the old belief system that Black birthing bodies can handle more pain. That crazy notion is still out there. Those kinds of things, assuming that they might have Medicaid and so you don't want to deal with them. And that whole thing plays and again, mistrust of the system. So we might not come until it's such an emergency at that point that it demands medical intervention, which in the birthing community, we know the more medical intervention, the more problems and more trauma and more likely a NICU or a maternal death is going to come along. So the social determinants are, again, they impact certain communities more. Food insecurity, food deserts, lack of transportation, lack of childcare, multi-generational housing. All of those kinds of things you put together affect, the Black and brown communities at drastically higher numbers. And this is just one of the areas that we see it. And why wouldn't we? Why wouldn't we see it here? We see it everywhere else. You know, somebody who goes in, a Black person walks in with a sickle cell anemia crisis, and even though they're on the fast track, one of the 5 fast trackers, they don't get back there very quickly at all because they're seen mostly as drug seekers. So if it already started there, why wouldn't it follow us all the way into the birthing room where we're allowed to assault women?
Yeah.
You know, we're allowed to do that in there. We're allowed to treat them like animals and not and have what we call coerced consent, which is not consent. It's coerced, right? It's not mutual, right, at all. And so it's really important that we have community programs like community doula programs, because doulas and midwives historically have less medical intervention, less trauma, less all of that. And if it starts there, we're going to be rolling in the positives more than, right, the negatives, which kind of set it up. Yeah,
absolutely. No, thank you again for sharing all of that, because I became aware of the social determinants of health again through my stop at the health department. And it's huge, and it does have, those factors definitely have a huge impact on your ability to care for yourself in a healthy way. So
yeah. I just want to say that it's not just something that people talk about, that Black and brown communities are treated differently. They are. I work for community for the capital area Healthy Start, and a large portion of who we're working with are people who have a lot of the social determinants. They're on Medicaid, they're underage, they might have open DCF cases, there might be domestic violence, all those intersectionalities that just create this, just this very difficult ability for someone to mother the way they want to mother.
Yeah.
And when it can be very twisted on someone easily by the white colonized system, when someone in the Black community might say, I don't trust y'all, so they delayed going to the hospital, they didn't want certain people coming into their home. That individual, when you talked to all of the medical professionals around them, all the white people said that person was non-compliant, right? What an interesting word, non-compliant, right? Right. When I don't view it that way at all. That's not at all what the truth is at all. That person was not at all non-compliant. They were following their truth. They were following what they felt they needed to do to survive. Right. And it might not agree with you. That doesn't mean I'm non-compliant. Does everybody remember like Elaine's episode in Seinfeld back in the 90s, where she was like, what are you writing if you put I'm difficult in my medical chart?
Right.
That follows Black and brown women more. Okay. Right. And so we use hesitant, cautious, guarded. Right? Okay. Which are more person-centered.
Yes.
Right? Versus colonized.
Yes. Thank you for that language. Because I think KJ said it best. Thank you, Lola, for saying it's what some people are afraid to say. And I think sometimes don't even know how to say it. Like, so yeah, I'm gonna just leave it there. So I feel like we could talk a whole nother hour, but we are coming close to the end of our time. So I'm gonna give you an opportunity to give some closing remarks and to tell folks how they can connect with you, and then any resources that we need to be made aware of as it relates to maternal mental health.
Well, thank you, Nicole, for giving me this platform. You have a huge place in the community. And so this was an opportunity to really kind of have this dialogue, so that if one person right, could maybe understand how they felt, or kind of knows maybe what to say to their friend, sister, cousin next time, that our daughters and their daughters and their daughters hopefully are going to not have to be dealing with this, not have to be dying. We should not be in a first world country and have the highest death rate. This is insanity. We shouldn't feel as mothers, as women, that a shower is a luxury, right?
Mhm.
And so there are definitely places to get resources and support. The first one, the beacon, is Postpartum Support International. They're the ones who, do the only certification for this niche. For maternal mental health, they have over 50 support groups. They are international. They have a conference every year. They offer the advanced trainings. They have a directory. So if someone's like, I'm just going to Google postpartum depression Tallahassee, PSI, Postpartum Support International, has local volunteers who would be able to help locate who's closest to you that can help you, that is a maternal mental health specialist. So they're definitely an agency that is who we often refer to. They also have a maternal warm line. So it's a warm line, okay? It's not a suicide hotline, it's a warm line. It's where you can call for maternal mental health stuff and talk about it with someone who is trained, okay? So there won't be judgment, there won't be any of that. There will be all the space that you need. We have Cherished Mom. They are very involved in postpartum psychosis. They're the one who's in charge of Postpartum Psychosis Awareness Day. Their founder, what is a survivor of postpartum psychosis, and we need those stories. Hashtag storytelling saves lives. Okay. We also have Zero to Thrive. That is very much focused on pregnancy and infant loss. The founder of that had her own lived experience and was given no information. Again, another lack. Okay, where what we want, our goals in this is, no matter what entry point we're at, we want everyone to know when they're walking out of a hospital, when they're walking out of an OB office, when they're walking out of a health department. We want them to know the information. So walking out of a hospital and not knowing, right, what is coming next after you've had a miscarriage or a stillbirth or anything like that is a tragedy and is insane. And so she started that for a reason. Lots of support groups. If they don't turn people away for not being able to pay for it, because again, right, wouldn't that be just so elitist? Okay, right? Like, ooh, only rich people can do this. And so the last one I definitely want to point out is, I believe it's called Shades of Blue, right, Nicole? And they are who are in charge of Black Maternal Mental Health Week. Again, specific, needed, real, and gets down to the realities of what Black birthing bodies have in front of them when they make the decision to do this. And so they are very important as like resources. Okay. And then besides the Postpartum Support International Warm Line, there is also the National Maternal Mental Health Hotline that through the Biden administration got approved, and PSI is the one who mans it, just so everybody knows. That's who actually is answering is us. But anyway, so that number is up there as well. And of course, if we're having feelings of hurting ourselves or anyone else, of course, there's the suicide hotline that has not changed, the 988, I believe it is.
Mm-hmm.
I believe that is. But again, within our own community, we definitely want to start within our own community. Are there, right? We want to look around. How can we take care of ourselves? Is getting enough rest, right? Especially trying to get at least a 4-hour, not put together, right? But 4 hours solid of sleep minimum, or that lack of, right? Sleep deprivation is a tool of war. It'll get us. It'll get all of us. We're not immune to that. And so moving our body, getting outside, finding a local support group. If you can't find one online that's free, finding a counselor. Don't forget our joys, our own personal joys. Let's not disappear. We oftentimes, as women, caregivers, people pleasers, we tend to disappear, and everyone else, our children and our husbands and partners, are above us. And so we need to remember ourselves in that, and our own personal joys, our own autonomy, our own agency. Shades of blue. Yes, absolutely. And hey, you know what? Here's my challenge. If there isn't a support group in your area, start one, right? Start one. It starts with someone, it starts somewhere. I'd say start one yourself then, because guess what? As you can see, plenty of people need somewhere to go.
Absolutely. And they can reach out to you via Gmail, text, Facebook, Instagram. All of that is scrolling across the bottom. You've said a lot in those last few minutes, so I know you might need to take a drink.
Yes, I do. Thank you. Oh,
No problem. So Lola's information is at the bottom of the screen, and she told me before we got on the air that she is taking new clients. So if you or someone in the state of Florida are in need of these services, please, please, please do reach out. Lynette, she said, are any of these programs on the cutting block with this administration?
yeah, a large portion of them, which is why part of what I was saying about language is when I'm in my capacity at Healthy Area, Healthy Start, I can't say chest feeding anymore. I have to go back to breastfeeding, and I can't say birthing bodies anymore. I have to say women. And so that alone is already showing the cracks that are starting. And so health departments and WIC and all that is expected to start rolling as well about those programs being cut. Just at our own Healthy Start, a fund, one of the grants was not renewed because of the language that was in it. And so we are seeing it just at our own community, let alone national.
Okay. Great question, Lynette. Thank you. She said, find our glimmers, what gives us joy. Absolutely. And so I really enjoyed those final comments that you gave, and I took notes. All right. So minimum of 4 hours of sleep all together. Move your body, get outside. Don't forget your joys. Don't disappear. Start a support group if there's not one where you are. So, Lola, thank you so much for your time tonight. This has been a great conversation, a great way to kick off Maternal Health Month, Maternal Health Awareness Week, Maternal Health Day, I believe, is on the 7th.
Yes.
So, but again, it's all month long. So, let's check in on the maternal, the mental health of our moms, and just let's share this. Let's keep this conversation going, because I think there's so much to be gleaned from what has been shared here tonight. I hope you all have found this conversation beneficial. If you have, let us know in the comments. Give us a thumbs up, a heart, or something. Let us know in the comments if you found this beneficial. I see a few folks are chiming in. Little Breeza, you're the greatest, Lola. Mamas are lucky to have you. Absolutely, I agree. Lynette, wonderful resource, especially because in that moment you don't want to have to research, you just want help. Yes.
True.
Very good. Stacy, thank you for such a great and informative conversation. I tell my docs I expect you to work with and collaborate with my other providers. If you can't, then we aren't a match. We all need to practice this. Yes, love it.
That's right.
Yes,
right.
yes.
And see, those are boundaries, right? I have a boundary, right?
Yeah.
If you cannot match that, then you are not right for me.
Yeah, it's not
Very
a good match, and that's okay. That's all right. Gail, great conversation. Thank you. Lynette, this was so
Thank
informative. Thank
you.
you, Lola. Thank you, Rachel. Fabulous information. Thank you, Lynette. I hope you write a book. All right, you heard it here.
Woo!
Thanks, Nicole, for a great guest speaker, great conversation night, all wonderful. So, I
Thank you.
I gotta mention too, Conversations with Nicole is on Mondays and Wednesdays on YouTube and Facebook. So I invite folks to subscribe to the Conversations with Nicole YouTube channel. Again, we are live here on Mondays and Wednesdays at 8:30 p.m. Focus on mental health and wellness, especially in Black and Brown communities. And we try to stay up with what is the hot topics or what's really happening in our community and in the culture. So this is right on time, Lola. I really, really do appreciate you.
Thank you.
All right. Miss Keisha, wonderful. Thank you, Nicole, for sharing your platform. This was amazing. Thank you,
Yeah.
Keisha J. Appreciate you.
Thank you, everyone.
Yes. All right, good people. So have a great rest of the evening. Stay safe, and we will see you next time. Bye.
Bye.